Good day everyone, I am Magsombol from BSN1-Y3-M10B, and today I'll be doing my written demonstration about hot and cold compress application. So first is the hot compress. So hot compress helps to relax the tight muscles and improve the blood flow of the patient, which can ease the pain and stiffness. So first I'll be identifying my patient using the identifiers. So sir, I'm your student nurse for today. May I know your full name and birthday? Okay, thank you. So next is to verify the doctor's order. So to know the type of heat application, the location, duration, and the desired temperature to the patient. So I already verified the order of the doctor, and next is to review the client's medical history. So I already checked the client's chart or the medical history of the patient. So next is to obtain the vital signs before the procedure to the patient to know the vital signs of the patient. So next is to assemble and prepare the needed equipment. So I already prepared the needed equipments to the bedside. So next is to provide privacy to my patient. So I already closed the curtains and the door to provide the privacy to my patient. Next is to explain the procedure to the patient and the feeling that he might feel during the treatment. So sir, I'll be doing the hot compress to your affected body, and would that be okay?
Yes.
So upon applying the hot compress, you might feel some burning sensation. So next is to perform hand hygiene and don my gloves. So after the putting the clean gloves, next is to put a absorbent towel to the under the exposed body part of the patient. So next is to apply the hot compress to the affected body part of the patient. So always take note to the temperature of the hot compress to prevent the patient from burning. And leave it for 30 minutes or the as ordered by the doctor. Next lang. Tapos, ayun, check the vital signs. Tapos, document. So, after the time ordered by the doctor, remove the hot compress and also the underpod. And next is to perform obtain the vital signs after the procedure to compare the vital signs of the patient before and after the procedure, and document the application of the hot compress and also the response of the patient. So I am now done with the hot compress. I will now proceed to the cold compress. So cold compress helps to reduce swelling and numb pain, especially to the after a new injury like a bump or sprain. Using the right one helps the body heals faster and feel better. So I already identify my patient and also verifies the doctor's order and review the medical history of my patient. So I will now explain the procedure to the patient. So, sir, I'll be doing the cold compress. So, will that be okay? So, upon applying the cold compress, you might feel some numbness to your affected body. So I will now proceed to the procedure itself. So first, I will now expose the affected body part of the patient, and also next is to put some underpad to prevent the fluid to or liquid to spill from the underlinen. So next is to put the cold compress. So since I do not have the since I don't have the ice bag here, so I will use some cloth and put some ice on it. So next is to apply the cold compress to the patient affected body part. So leave the cold compress to the time ordered by the doctor and wait until it finishes. So after the time ordered by the doctor, I will now remove the cold compress to the affected body part of the patient, and also remove the underpad and cover the patient. So I am now done with the cold compress. So I will now remove my gloves and perform hand hygiene. And after performing the hand hygiene, I will now document the procedure and also the patient's response.